fingers placed firmly against your face or head can be substituted for the resistance of the pillow, allowing you to perform the exercises in almost any convenient location. You must work with your doctor or physical therapist to determine how many exercise sessions per day and how many repetitions of a particular exercise at each session is appropriate for you. Exercise 6. This exercise is designed to strengthen the sternocleidomastoid muscle, which rotates the head and pulls the chin down toward the chest. On this model, the bulging left sternocleidomastoid can be seen. We'll choose the left-sided muscle for demonstration. Start in a seated position facing parallel to a wall. Your right shoulder should just barely touch the wall. Place the foam pillow on top of your right shoulder flush with the wall. Place the side of your face snugly against the pillow as shown. Now, turn your head slowly as if looking over to your right. Try to feel this muscle bulging as you rotate your head. Rotate your head until you are pressing as hard as you comfortably can. Hold for 30 seconds, then release and relax. Repeat this exercise 3 to 5 times per exercise session. This entire procedure may be reversed for strengthening the left side. Exercise 7. The next exercise is designed to strengthen muscles which elevate the shoulder and shoulder blade. These include the trapezius and the levator scapulae. We will select the left-sided muscles for demonstration. In the seated position, grasp a handhold beside you. Now, slowly shrug the shoulder without moving your head. For clarity, we'll show you what the movement would look like without the handhold being grasped. And now, with the handhold. Remember that the pulling should be done with your shoulder shrug only. Try to keep your arm straight and do not try to lift by bending your arm. Pull with your shoulder muscles as hard as you comfortably can. Hold for 30 seconds, then slowly release and relax. Repeat this exercise 3 to 5 times per exercise session. The entire procedure can be reversed for strengthening the right shoulder muscles. Exercise 8. This exercise is designed to strengthen the muscles which lie along the back of the neck on either side of the neck bones. These include the diagonally running splenius capitis muscle. We'll select the right-sided splenius capitis for demonstration. This muscle tilts the head backwards and turns the chin toward the right. Start the exercise lying on your back with the foam block underneath your head. Rotate your head approximately 45 degrees to the right. Now tilt your head backwards, pushing into the foam block. Try to push against the block with the part of your head immediately behind and above your right ear. Push as hard as you comfortably can. Hold for 10 seconds, then slowly release and relax. Repeat this exercise 3 to 5 times per exercise session. The entire procedure can be reversed for strengthening the left side. Exercise 9. This is an alternative stretch and can be used if both the right and left sternocleidomastoid muscles need to be strengthened. Start in the position shown, lying on your back. Next, lift your head upwards off the surface and place a hand against your forehead. Push downward with your hand while keeping your head elevated. Push as hard as you comfortably can. Hold for 10 seconds, then release and relax. Repeat this exercise 3 to 5 times per training session. Exercise 10. The next exercise is designed to strengthen muscles which tilt the head sideways, including the sternocleidomastoid, trapezius, levator scapulae, and scalenes. We'll select the right-sided muscles for demonstration. Begin in the seated position as shown on a chair with your right shoulder touching the wall. Place the pillow on top of your right shoulder flush with the wall. Place the side of your head snugly against the pillow as shown. Now, tilt your head directly sideways to the right, pushing into the pillow. Push as hard as you comfortably can. Hold for 10 seconds, then slowly release and relax. Repeat this exercise 3 to 5 times per exercise session. The entire procedure can be reversed for strengthening the left-sided neck muscles. Exercise 11. This next exercise is designed to strengthen all of the muscles that tilt the head straight backwards. These are all of the muscles that lie along the back of the neck on both sides of the spine. Both sides will be strengthened simultaneously. Begin in the position shown, lying on your back on a firm surface with the foam pillow underneath your head. Tilt your head straight backwards, pushing into the foam block. Push as hard as you comfortably can. Hold for 10 seconds, then slowly release and relax. This exercise should be performed 3 to 5 times per training session.
In the following tape, you will see some techniques employed by Jean-Pierre Bleton, head physical therapist at the St. Anne Hospital, Paris, France. Jean-Pierre Bleton demonstrates these techniques at a symposium for the National Spasmodic Torticollis Association held in September of 2001. The patient has left rotational torticollis with clonic, which involves the shaking of the head. It is important for you, as a patient with spasmodic torticollis, to know the muscles involved and how they affect your disorder. These muscles are the sternocleidomastoid muscle, the splenius capitis, and the levator scapulae. You can feel these muscles by using your index finger and thumb and pinch the sides of the neck. Pick up the neck tissue with your index finger and thumb and pinch the muscle down towards your collarbone. This muscle is the sternocleidomastoid, or SCM. The splenius capitis is the muscle at the rear of your neck that attaches to the base of your skull. The purpose of these exercises is to teach your muscles to relax and contract. Contract the weaker muscles, relax the muscles that are pulling and firing. You may want to stop the tape and review portions at any time. The goal here is to help you understand each step. These are beginning steps to help you reach your personal goal of an exercise program that really helps you. Remain positive in your attitude. You will want to take small steps to accomplish your goal. In the first exercise, Jean-Pierre Bleton invites the patient to lie down on the table provided. Notice that there are pillows provided for the head and neck area as well as under her knees. This posture will enhance the relaxation and lead to more successful exercise motions. If possible, have someone help you get your head to center, and then move your head side to side gently. They can slowly lift the back of your head from the base of the skull in an up and down movement until you feel the muscles relax. It is important for you to notice the sensation associated with your muscles. You must feel your muscles and be conscious of the contractions and the relaxation moments. What we are seeing is a combination of relaxation and action. Relaxation and action. Jean-Pierre Bleton wiggles his finger and asks the patient to look at his fingers. Moving the eyes to the right helps the patient to turn her head in that direction. Focusing with your eyes on an object or person will reinforce that motion that you are attempting to accomplish. The object here is to get your neck into a natural curve. Your neck may feel rigid because all of the muscles are tight and will not allow you to curve your neck to a normal or neutral position. Remember, relaxation and action. Once you have spent enough time relaxing the muscles of your neck, then you can begin this exercise. Turn your head to the right, using your finger on your right cheek, and lift your head up off the pillow. Turn your eyes to the right and hold that position for a count of 20. Do not give up, even if it takes you a month to do this exercise by yourself at home. Eventually, you can increase the number of times that you can hold your head and do this exercise until you do it 6 times for a count of 20. Then relax and rest for a few moments without allowing your head to twist back to the left or in the direction of your torticollis. You have to work to get to this point, but remember to do this exercise slowly and to utilize the relaxation phase before and in between each exercise. The purpose of breathing in a conscious pattern is to help relax the contracted muscles. The next exercise involves breathing. Jean-Pierre asks the patient to take deep breaths while he gently applies pressure to her upper chest. You can also apply pressure with your hand on your chest at the clavicle or collarbone. Breathe out with gentle pressure on your chest using your own hand, and then breathe in as you remove your hand from your chest. Once again, you must feel your muscles, the muscles that are beside the front of your neck on either side. Deep breathing is very conducive to relaxation and enhances the other exercises. The patient is also asked to blow on his hand as she exhales. You can do the same. You may use the breathing technique several times while turning your head to the right. Relax and then allow your head to come to the neutral position. Repeat the breathing and head turning as many times as you can. This exercise will help to relax the left sternocleidomastoid muscle. Jean-Pierre suggests that other things that you can do to promote this movement are to read a book aloud, holding the book to the center or to the right side. He also suggests reading poems aloud that you enjoy. He approaches the wall and shows the audience how a patient could read with their head turned to the right and their back against the wall. One of the main objectives of this exercise is to retrain the neck muscles to contract and relax. You are setting a new pattern for the muscles to compensate for the torticollis. Sometimes it is easier to get your brain to contract than to get your muscles to to relax. In the final phase, as you begin to feel good about yourself and your exercises, you will realize that by contracting muscles that are weak and by relaxing muscles that are too tight, you are developing a new pattern for your head and neck and for your life. As the patient changes to a seated position, Jean-Pierre guides her to bring the exercises to a conclusion. He encourages her to turn her head to the right slowly, bringing her head to midline and then turning to the right again. He keeps his hand in front of her face and moves it back to her right side several times, sometimes touching her cheek or inviting her eyes to follow the movement of his hand. You too can employ the same technique to bring your head to the right and hold it in place for a count of 10. Your goal is to keep your